So what we're going to talk to you about now are the different kinds of ways that you can support a clinic in using the 6 building blocks program. What Michael just spoke to you about with the study was the use of this comprehensive 3-stage program. But what we have learned along the way is that not everyone has the resources or is really at that fresh starting place that they need to do the comprehensive 3-stage program. So over time, we've also iterated this tailored targeted program as well. So we're going to talk to you about both of these today. What are the stages of work for the comprehensive 3-stage program? So the next slide gives you a sense of what this sort of timeline looks like. And it's a flexible timeline. It really depends on how many resources a clinic is putting to the work and what is the place that they are starting from, whether it could last anywhere from 6 to 15 months to make these implementation changes. It's a 3-stage program, starting with the prepare and launch stage, which can be anywhere from months 1 through 6, the design and implement stage, which is months 4 through 14. And then there's a final month that you help a clinic figure out what their monitoring and sustaining plan is for keeping this work going. Stage 1. So what the aims of the prepare and launch stage is really about preparing a clinic to do this work and then launching the work. So you're going to ground your team and your clinic in a common understanding of what is the current evidence and guidelines and regulations that are relevant to management of chronic pain and the use of opioids for chronic pain. You'll have a chance to build what we call an opioid improvement team, and this is the team that's really driving the work forward and providing the critical leadership for the improvement efforts. And a lot that is involved in the prepare and launch stage is really about building capacity within that team to be successful in the improvement work. There's a lot of assessment that happens during the prepare and launch stage, because before you can begin making changes, you really have to understand what is your baseline, both as a team and as a clinic, for everyone to be on the same page and to be able to contribute to an understanding of where there are room for improvement and where there might be really excellent things going on that should be spread throughout the clinic. It's also a time to prioritize through learning about what the evidence and guidelines and regulations are and learning about what existing practices are happening. You're able to begin to identify what the project aims should be that are most appropriate for your clinic, what your team and clinic think. And then this is really also about generating enthusiasm. Clinics have a lot going on, many competing priorities, and in order for this to be successful, you have to have clinic buy-in. So this project involves your entire organization. It's really critical to help the entire clinic understand why this work is important. And on the website, on the prepare and launch page and the implementation guide, and actually if you want in the future, there's also just links on the page as well. What you see here are the milestones that many clinics work to achieve during the prepare and launch stage. So if you scroll down, Ashley, there's things like beginning to create a list of who the patients are who are in long-term opioid therapy, completing a self-assessment, both as an opioid improvement team and as a clinic, locating and assessing what's the use of patient education and support resources that we have related to opioid management. And if you scroll back up again, you'll see that you're helping a clinic work to achieve these milestones through these 4 meetings in the green and the upper right there. So the first is where you meet with clinical leadership to really get their commitment that they are willing to set aside time for folks to be working on this and putting resources to it, particularly the tracking and monitoring, which can take a little bit of effort. And then there are 2 meetings with the opioid improvement team that I mentioned. This is that team that is helping to drive the work at the clinic, and they will do in-depth assessments in each of the building blocks and also plan a kickoff, which is the final meeting. And our clinic-wide kickoff is where everyone in the clinic that works with these patients, from front desk to the providers, to the MAs and nurses. Everyone in the clinic has a chance to get together, learn about what the project is, learn what the opioid improvement team has discovered through their in-depth assessments, and also have an opportunity to do a small group activity where they are able to think about how things are going and where they see there's room for improvement. So this is the work of the prepare and launch stage that a practice facilitator helps the clinic work through. The second stage is the design and implement stage, and this is the longest stage because this is where the work is getting done. So once a opioid improvement team has really taken time to think and examine where there's room for improvement, this is a chance to get to make those improvements. So it's using the 6 building blocks to redesign care for their patients who are on long-term opioid therapy. And usually this begins with a look at the policy and patient agreement that exists in the clinic, and then goes on to implement all of those different improvements that were identified during the prepare and launch stage. And throughout this design and implementation process, this is quality improvement. So it's testing, making this change, assessing how it went, adjusting it, and fine-tuning along the way. On the website, you will see that in the upper right-hand corner again, how a practice facilitator is supporting a clinic in redesigning their care. So at the top are these action plan meetings, which we're going to talk about in more detail in a future training. But this is a time when a practice facilitator can meet with the opioid improvement team and say, hey, how's that work going that you've been doing? What have you learned so far? What do you think you might need to try to do next? Let's brainstorm ideas of what the next steps will be and who's going to be involved. And so it's really driving the work forward. It's a method of accountability, and it's really where the nitty-gritty planning for the work takes place. The clinic will be reaching out to the quality improvement lead, to the practice facilitator, asking for help. That practice facilitator or coach will be checking in and sharing resources, which we will see. You can see now as a little sneak preview, and feel free to poke around if you followed our website link on your own. But the helpful resources tab is filled with resources that are helpful for a clinic who are making these implementation changes. And then you'll see this bubble called shared learning calls. I love shared learning calls. So if you are a practice facilitator who is doing this work with multiple clinics, there's so much benefit in having these calls, which is where once a month you get the opioid improvement team at each of the clinics together on the phone and talk about what is really hard right now. And do you have any ideas about how to handle this? Do you have an EHR template that can help us through this process? Or we had this great success. Let me tell you all about it so that you can take advantage of our learnings in your clinic. So if you can scroll through down below, all of this support is helping a clinic implement the milestones that they have identified are important to them through the prepare and launch stage. So this is a pretty long list, and not all clinics will want to work on all of these. You'll have to identify what is needed at your clinic. So for example, under planned patient-centered visits, a milestone is that data are used for pre-visit planning. Or for caring for patients with complex needs, the tools have been selected and are consistently in use to identify the patients who have complex needs like opioid use disorder or mental behavioral health disorders such as PTSD. If you scroll up, you'll see in tracking and monitoring that you have identified who all your patients are who are on long-term opioid therapy and have a process for continuing to identify them as you have new patients. This is a big win when clinics are able to achieve this, and there's usually much celebration happening at this point. So there's quite a few milestones. So our final stage is monitor and sustain. This is really just a 1-month stage where, as a practice facilitator, you recognize with the clinic that they're at a place where they have implemented the majority of changes that they want to implement, and they're really at a place of just sustaining that work and monitoring and making sure things are still going well. So during this stage, you work with a clinic to assess and celebrate all the progress that they have made from the beginning of the project. It's really nice to take a moment and say, look at what you've done. Remember how you started here, and the front desk was talking about how they were constantly getting harassed, and now you've talked to them and they say, oh my gosh, that almost never happens. That's something to celebrate. So this is part of what's happening during this stage. You're also working with the clinic to develop a plan for sustainability, for making sure that the changes that have been made will continue, and launching the clinic to be able to continue to work independently.
There are many ways to come to the 6 building blocks. And a lot's happened since the original study that Michael talked about, in which we developed and then tested that comprehensive program. The CDC put out its guidelines in March of 2016. I can't believe it's been 5 years now, for prescribing opioids for chronic pain. Many states have legislation, they've developed rules and regulations related to opioid prescribing. And so because of those things, many clinics have actually made changes in response to these guidelines and the legislation and rules. We heard about this opioid toolkit through Meditech, which is a fantastic resource. And so while many clinics want to take advantage of the comprehensive, 6 to 15 months facilitated effort that Brooke just led us through, some think that they might not need that full facilitated effort. They might want to take a more targeted approach to improving the clinical program that they have in place. And we've found this to be true over the last few years. So that's why we've developed a more targeted approach that a practice facilitator can take to actually help a clinic bring to life some of these 6 building blocks changes. And I know there are many clinic representatives here at the training. This is really going to be talking about what a practice facilitator, how a practice facilitator might enact this targeted 6 building blocks program. But you'll get a sense for how you might be thinking about the type of 6 building blocks program that you'd like to put into place, the comprehensive program versus a more targeted approach. So this targeted approach is a way for practice facilitators to really tailor the program to where the clinic is at. What is the clinic's current opioid management improvement needs? And the facilitator can actually work with the clinic to first identify what is the best program option for your needs. So is it the comprehensive program? Is it one of these tailored or targeted approaches? And we have a number of 6 building blocks materials, both to address the needs that are identified, but also to figure out which of the programs is best. So on the website, in the practice facilitator section, there are resources. There are practice facilitator resources. I think it's in helpful resources for practice facilitators. There's an introduction to the 6 building blocks handout that talks about the different approaches. There's also a PowerPoint called the commitment slides that discusses the targeted approach in addition to the comprehensive approach. And at the end of June, we'll have a new tool that's going to be released onto the website that's called the Fast Track Guide. And it's really meant to support clinics that have already done some opioid improvement work and helps them think about this more targeted approach. So that section of the website might be useful to you as a practice facilitator if you're working with a clinic that might need a more targeted approach, or if you're a clinic wanting to take that more targeted approach. We share a couple of the ways that a targeted approach could be taken. One of them is called the 6 building blocks consultation, and this is where the facilitator actually provides more focused facilitated guidance in doing an in-depth assessment with a clinic as to where they're at. In this way, the facilitator can help identify the areas for chronic pain and opioid management improvement, and will end up providing a written recommendation for what are the areas where there might be some deviation from evidence-based practice, or there might be some opportunities for changes in tracking and monitoring, those kinds of things. The clinic champion and the quality improvement manager who's working with the practice facilitator works with them and completes a self-assessment at the clinic level and gathers existing resources, very much like the prepare and launch work that's done. And that helps the facilitator then be able to kind of assess where you're at and or where the clinic is at and provide those recommendations. And this often takes 1 to 3 months, depending on how easy it is to get access to all of those materials. The second option is the technical assistance. And this is where the 6 building blocks facilitator provides support and technical assistance in specific opioid management areas as needed. These areas might be identified through a consultation, or a clinic may already know, gosh, what we really need is to true up our policies because there's some new evidence-based care and guidelines that we just haven't trued our policies up to yet. Or they might say, gosh, we've got policies in place, we have some procedures we've worked out, but we don't actually know what the workflow should look like to support implementation of our policies. So they might want to work specifically on workflows. Or a clinic might want to create a tracking and monitoring system. They might say, gosh, we've got policies, we've got procedures, we've got workflows, but we don't know who our patients are. So we can't really track or monitor any of this. We need to work on this area. So this technical assistance is really a more targeted way to work on a specific area of need. And what will often happen with the clinic is that the practice facilitator will work with clinic representatives to develop what would the action plan look like to address this need, and then support the clinic as they're implementing their action plan. So this has a variable timeline depending on the project that's undertaken. So if you're a facilitator and you're conducting a 6 building blocks consultation, like I said, this is kind of a variation on that prepare and launch stage. And so the activities here is first, the practice facilitator would meet with a clinic improvement team, talk about what the consult is going to look like, and provide some materials that allow the clinic to do a self-assessment of where they're at with the 6 building blocks, and ask for some existing materials related to opioid management. In the next step, the practice facilitator would actually lead the clinic through a couple of those meetings that Brooke talked about, those assessment meetings in the prepare and launch stage. And the clinic would have gathered the existing materials they have related to chronic pain and opioid management and review those during one of those meetings, or actually both of those meetings. And the clinic would conduct during this time this self-assessment, as I mentioned. And we actually have a self-assessment form. It could be conducted independently by the clinic improvement team. They could take the form, they could distribute it to diverse types of clinic personnel, front desk, medical assistants, providers, both behavioral and medical. And so they could do that independently. Some might want to do that in a med staff meeting or something like that. Or there could be an opportunity for the practice facilitator and a clinical advisor to the practice facilitator, if available, to work with a team of clinic representatives, like a provider, a front desk staff member, an MA or a nurse, an administrator, to complete the assessment in that small group setting. So however that works best for the clinic, or what the clinic thinks is the best way to do that self-assessment, would happen. And then the practice facilitator will take all of those materials. What does the assessment look like? What existing materials are there? Review those materials, take a look at the 6 building blocks, and prepare a written feedback report to the clinic on the potential areas for improvement. And then the practice facilitator would meet with the clinic to provide that feedback, talk about whether the clinic would like to move on to the technical assistance opportunity in any of those areas. So like I said, this usually is a 1 to 3 month proposition. So for the technical assistance, this is really a way in which the practice facilitator supports the clinic in its redesign efforts related to the area of need that they've identified, or several areas of need. So the first step is identifying the need. Like I said before, the clinic might already know what their need is, or they might discover it through a consultation process. In the second step, the practice facilitator then meets with the clinic and its improvement team to kind of share what the resources are in the 6 building blocks areas. So we have model policies and patient agreements. We have model workflows. We have guidance in terms of how to conduct tracking and monitoring given where you may be at with your electronic health record. What kinds of measures might be useful to track, as was mentioned earlier, for either sustainment or looking at the success of the program that you put into place. And then the clinic would choose what offerings are relevant to their needs. And the practice facilitator would then support the clinic in moving forward with doing that work. First, kind of looking at what's the current state, where are you at now, where do you want to get to, and then developing and supporting an action plan to address that need. Sometimes we've found that a clinic may not even need specific resources. So we had a team that worked with a clinic recently where what the clinic actually needed was a meeting to brainstorm about how to manage opioid refills because they were transitioning from a written registry that they had to a new electronic health record. So they wanted to figure out, gosh, how could we use this? So sometimes the clinic is calling on the facilitator and a clinical advisor to the facilitator to just brainstorm and think of kind of what some fresh ideas are related to how to do the work. And again, the timeline for this varies depending on what the work is. What you can see here is that the actual work that's being done is very similar to what's happening in the comprehensive program. It's just targeted to specific areas. It may be that the consultation identifies that there are many areas to work in, at which point you've done the prepare and launch phase, and it's time to move on to the design and implement of the comprehensive program.